Most STIs stay silent, yet they can harm fertility and long-term health. Doctors stress early testing, awareness and treatment for better sexual well-being. Sexually transmitted infections (STIs) are infections that spread primarily through sexual contact. They can also be transmitted through non-sexual routes, such as from an infected mother to the newborn during pregnancy and childbirth, through blood products and tissue transfer. More than 30 microorganisms, viral, bacterial, protozoal, and parasitic organisms are associated with various STIs. Taboos around sex, associated stigma, discrimination and hesitation in discussing sexual health pose a major barrier to accessing care. STIs significantly affect sexual and reproductive health, contributing to infertility, adverse pregnancy outcomes and various cancers. According to Dr. Abhilasha Kochar, Senior Consultant Microbiology and Molecular Biology, MD Microbiology, Metropolis Healthcare Limited, the majority of cases of all STIs remain asymptomatic, which may cause them to go unattended. At times, presenting symptoms may include oral or genital ulcers, vaginal, urethral or anorectal discharge, anal or genital discharge, lower abdominal pain, fever, rash or mucocutaneous erosions. Absence of signs symptoms does not rule out the possibility of an STI. An asymptomatic individual can still transmit infection to sexual partners and may develop long-term complications. Co-infections with more than one STI are also possible. Not every act of unprotected sex needs to result in sturdy transmission. STI transmission is influenced by sexual, behavioral, biological factors. Certain biological factors that influence transmission of STIs include age, sex, immune status of the host and virulence of the organism. Behavioral factors referred to include indulgence in risky behavior like inconsistent or no condom use during sexual acts, multiple or casual sexual partners, sexual activity with sex workers, and transactional sex, which can affect the possibility of contracting STIs. Even individuals without any risky behavior can be vulnerable if their partner indulges in high-risk behavior, has an STI and injects drugs. The traditional clinical approach, the syndromic approach and the laboratory-assisted approach are three common approaches used in the management of STIs. The syndromic approach is the backbone of India's National AIDS and STD control program. A limitation of this approach is that it is not effective for asymptomatic patients. An asymptomatic patient, that is, a person with a history of STI-related risk behavior or exposure but shows no symptom signs, referred to as a silent STI, remains infectious and is at risk of complications. They need to be diagnosed and treated adequately, making laboratory-based testing critical. Both laboratory-based and point-of-care POC tests aid in the screening and diagnosis of STIs. Tests available to screen out common STIs, for example, HIV, chlamydia, syphilis, HPV, gonococcus, include serological tests for the detection of antibodies or antigens and molecular tests like RT-PCR for specific organisms performed on blood samples or vaginal swabs tissue samples. To conclude, screening for silent STIs is particularly important for high-risk individuals, as it enables early targeted treatment and prevention strategies, supports comprehensive sexual health evaluation and detects co-infections. Disclaimer: tips and suggestions mentioned in the article are for general information purposes only and should not be construed as professional medical advice. Always consult your doctor or a dietitian before starting any fitness program or making any changes to your diet. Also read lump or swelling in vagina. Doctor explains why it may be a STI.